Hi, I'm Joanna Clark with Blissful Baby Sleep Coaching. And as you know, I'm always trying to bring you amazing experts to talk about topics that are really important to the mothers that I am working with every single day, because I want to make mom's life easier. So I'm very proud to bring on Dr. Elise Hamilton of Hamilton Chiropractic in Belmont, California, which is in Northern California. And Elise is an expert in pediatric chiropractic. And today she is going to talk to us about why your baby needs this. So Elise, why don't you tell us why our babies need this?
Yes, thank you for having me. I'm so happy to share this information with you. Yes, your baby needs chiropractic care. There's a lot of people who think that chiropractic care is only for adults, and maybe you have only thought of that for adults for back pain, neck pain, but chiropractic care is so much more than just for adults. And so babies get really great results through chiropractic care and can help with lots of different issues that may be coming up and making them a little bit cranky and upset, and we don't know why.
So, for example, I, initially I always thought of a pediatric chiropractor like for conditions like torticollis, where they come post-birth and they have limited mobility in their neck. But maybe you can tell us some of the areas in which many of your patients are seeking your support to get relief for their baby.
Yes. I see a lot of babies for nursing and latching issues, lots of babies with the limited cervical range of motion, looking side to side or favoring one side more than the other, which also correlates to the nursing issues. A lot of babies with acid reflux or colic, or just cranky, upset babies with digestive issues. Ear infections, if they're having chronic ear infections, we see really, really great results through some of that.
And so I would imagine, I mean, one of the reasons why I want to have you on is I really want to emphasize that Dr. Elise is trained and certified in pediatric chiropractic. Like, this is something where you would really want to find a trained and certified pediatric chiropractor. And there is a website called ICPA the number 4 kids.com. That is tell me what that is. It's a national.
Yeah, it's a great database that you can go and find through your zip code any pediatric chiropractors that are certified through ICPA that are in your area. It's a great way to locate those good qualifying pediatric chiropractors.
So what if I hear this and I say, gosh, my child has an ear infection, or gosh, I'm having issues with latching, but that seems kind of scary and weird to go to a chiropractor. Can you explain what exactly is pediatric chiropractic and how it's different from maybe what people might be assuming? And
Absolutely.
I think that having them understand how gentle it is would be really important.
Yeah, chiropractic for babies and infants and children is extremely gentle. I use the amount of pressure that you would use just to press on your eyelid, or to find or check the ripeness of a tomato. So it's extremely gentle. A lot of my infants just sleep through the adjustment because it's so comfortable, and their little bodies can just kind of rest while I do that. And I've adjusted babies from, days old through, 6, 7, 8. So every age child, it's never, too soon. I work with a lot of moms that are pregnant. So it's a nice transition to get their babies under care right after they're born. And that's why I usually see babies so soon, is because their mom has been under care as a pregnant mom and then transitions and knows the importance of getting chiropractic care for their babies so soon.
So do you find that the majority of families, okay, besides the mothers that were under care with you and are already like, gosh, let's just, continue the care for our whole family, for the moms that this is new to, or they're wondering, hey, I'm really having an issue with ear infections, continuous, are people coming to you because they're having crisis, or can some of these issues, if they're seeing you as a brand new newborn, can some of these things be eliminated, the nursing and latching and ear infection issues be eliminated with consistent care?
Yeah, so they do normally seek me out because there's something going on, and they've either heard that chiropractic can help. Someone in their family said, recommended go see a chiropractor, or other professionals have said, take your baby to a chiropractor for these issues. So unfortunately, they do usually come seeking some sort of care for an issue. But if we are able to get the baby under care as soon as possible, we can eliminate some of these problems that can arise a little bit later. So typically, babies will come and see me like maybe 4 weeks. If I wasn't seeing them previously, in utero, then it's around 4-6 weeks is about the earliest that people are like, okay, I noticed that there's an issue going on, and so recommended looking for a chiropractor, or recommended me, so here I am. So that's kind of the timing that we see. And sometimes it happens later when parents get the news like, hey, a chiropractor would be helpful for this issue that's been going on for weeks to months. And the good news is that someone is spreading the word and sharing with them. But we need to let everybody know that it's a great resolution for a lot of these issues that moms don't think can be resolved with other.
Right. Well, I would imagine the nursing and the latch issue is a huge one. I'm not sure, we always would think, okay, let's go to a lactation consultant first, which obviously would be a really important step to build alignment with a certified lactation consultant. But it sounds like you can marry those two together to really help whatever the lactation consultant's telling you, to make sure that the child has the proper, can you talk about that? Because that's really intriguing.
Yes, and I work really close with a lactation consultant in our area who refers to me a lot with the babies that she works with. And so a lot of the issues that we see for nursing and lactation is through the neck and the face. Latching, so the jaw, and then also the very top bone in our spine is sometimes moved or just got misaligned through birth, and that's not allowing the baby to be able to move comfortably through their range of motion that they need to. So if they're stuck in, only wanting to look one way, they don't want to nurse on the other side because they don't want to turn their head because it's uncomfortable. And so mom's now having to deal with, doing one nursing hold on one side and then having to do a different nursing hold, but getting, both breasts being able to nurse from. So it's really exciting to help those moms when they're like, oh, I just don't know why she want the right one but not the left one, or the latch is just so painful. Maybe their jaw just needs a little adjustment, and then they're able to move it better. These little things that pediatric chiropractors are trained to look at and to examine and find that not everyone is thinking about, kind of thinking outside the box.
What a relief, right? Because if you're a nursing mom and this is something you really desire, and you're coming upon some challenges and you're under the care of your OB and your lactation consultant and you're still having some struggles, isn't it wonderful to know that there's another resource to go to, and that the solution is very, very gentle and can be extremely beneficial for the child and for the nursing relationship?
Yes.
And touch on the colic, because a lot of families experience babies with very sensitive nervous systems, which often means that they're very colicky and challenged in that area. Can you talk about that?
Yes. So to kind of go back to overview of how, why a baby might even need an adjustment, is if we think about the birth process, and if they're being birthed vaginally or through C-section, either way is stressful on mama and baby. And going through that birth canal, or even if, in some instances during C-section, they're just stuck in that birth canal, they're not able to get through, so there's a lot of pressure being put on their head and their neck, just being pushed and pushed and pushed, but they're not going anywhere, or, they are going somewhere, but it's very slow. All that pressure and stress from the uterus, contracting and pressing down is being put all on their little spine and their neck and their head. So you can imagine how much, what could happen after that. And they might not be comfortable after being born because things shift, they move, they need to, contract into themselves so that it can get through the small areas. So that is when we see, some misalignments of the spine in the neck and all the way down the spine. So our nervous system is what controls our entire body. So it starts at our head and sends messages down our spinal cord, out through the nerves that go to every cell, tissue, organ in our body. And as babies, we are, they're developing still. They're not, they are fully functional, but their digestive system needs a lot more growing, and just things need to develop a little bit more. And so as our body is going through that birth process and things are shifted, that can just put a little damper on the nervous system. And then it's not getting the message out to the rest of the body to know how to function right. So as I see my babies in the office, I look for those areas that aren't moving well in the spine to just help them move better so the nervous system can function better. And then the digestive system can function better. Their stomach, their lungs, everything is going to be functioning better. And that goes along with colic. So we see, just uncontrollable crying, and they're just upset or gas or constipation. All of that is really common when babies come into my office. And when I adjust them, I see a lot of poopy diapers afterwards.
Right.
Yes, and a lot of babies like to sleep after. It's kind of their system needs that downtime to take in what we've done and just rest, and then kind of do a reboot to help them get ready to function better.
Right. So what I hear you saying is, not only is this such a quiet, gentle, loving approach to nurturing your baby, right? You said that the touch is as tiny as what you would touch your eyelid, or, it's touching a tomato to determine if it's a good one to bring home.
Yes.
That's something, and that with a skilled practitioner, they know exactly where to go and what to do to really help bring back alignment, which helps bring the nerves into alignment, which then the babies can adapt really quickly after a rest, maybe a poopy diaper and a good rest, to really kind of rebuild themselves to eliminate some of those issues.
Yes.
Amazing. Again, guys, I just think it's amazing that, think about this: ear infections, latch issues, colic, acid reflux, torticollis. I mean, I'm sure there's even more, but those are the big ones that I know my moms are challenged by when I'm talking to them about sleep. I would say maybe we could just quickly touch on the relationship between sleep and chiropractic care. Maybe you could touch on that.
Yes. And like I've already mentioned, after they get their adjustment, they want to sleep. But that just shows you that their body needs that kind of downtime, and that their nervous system is a little bit more heightened. And so through chiropractic, their nervous system is able to just calm down, allowing them to be able to relax and go through that sleep and just be a little bit more restful. Or they're able to, their digestion is getting better, so they're not so uncomfortable, and they're able to sleep more. They're just in a different state, and they're happier. We see a lot of different just.
And for me, as a pediatric sleep consultant, I mean, I'm constantly referring out to pediatric chiropractors in the around the country, because at a certain point, I can tell if there's a medical condition inhibiting sleep. And I always recommend that they go get the care with their pediatrician and possibly a pediatric chiropractor to help handle the digestive issues or the ear infections and all these underlying issues that are already disrupting sleep. And then once that's handled, then the body is, and the nervous system is more aligned, so that when we are looking at the other reasons why the baby has disruptive sleep patterns, it's typically around behavioral modification and around sleep science techniques and sleep coaching methodologies that gets us through that other threshold. But we always have to kind of handle the underlying condition, which might, could, for some children and some babies, it can sometimes be easily managed through really great pediatric care, pediatric chiropractic care, and then they are in a different place. So when we go to approach the child through behavioral science, sleep science, and sleep coaching methodologies, it goes so much better, so much faster. Mm-hmm. And we know we've supported the baby in these in both levels, and the families know that they're being supported on both of these levels. So, well, thank you so much, Elise. This was fantastic. Absolutely. I learned so much, and I'm very encouraged by all the ways that pediatric chiropractic can help all the families out there that might be challenged with some of these areas. Can you just remind everybody how to find you, to learn it? Because I know you have a really active blog, and so even if you're not lucky enough to be in the San Francisco Bay Area, she's got amazing resources on her website. So Elise, Dr. Elise, can you tell us about that?
Sure. Yes, you can find me at HamiltonChiros with an S.com. And that's the best way. If you need to email me, get a hold of me through that. If you are in the Bay Area and you want to schedule, you can schedule online, and then you can check out our blogs, which are all about pediatric care, nursing, lots of different baby info on there.
Okay, great. Well, thank you so much.
Thank you so much for having me.